Ever wondered about the structure of the ulna bone in your forearm? This long bone lies parallel to the radius, its partner in the forearm. Acting as a stabilizer, the ulna allows the radius to pivot, producing movement. On its proximal end, the ulna articulates with the humerus at the elbow joint, while distally, it forms the distal radio-ulnar joint with the radius. Quite interesting, right? Now let's delve deeper into the proximal osteology of the ulna. The proximal end of the ulna is designed for movement and muscle attachment. Let's explore its important landmarks. First, we have the olecranon, a large bone projection that you can feel as the tip of your elbow. It's where the triceps brachii muscle attaches. Next is the coronoid process, a ridge of bone that forms part of the trochlear notch. Speaking of which, the trochlear notch, shaped like a wrench, is where the ulna articulates with the trochlea of the humerus. The radial notch, found on the lateral surface of the trochlear notch, is the articulation site with the head of the radius. Lastly, we have the tuberosity of the ulna, a roughened area just below the coronoid process, where the brachialis muscle attaches. These landmarks enable the ulna to play a crucial role in the movement of our forearm. Moving on, the middle section of the ulna, also known as the ulnar shaft, has its own unique features. The ulnar shaft, triangular in shape, serves as an attachment site for various muscles. It has three unique surfaces. The anterior surface is where the pronator quadratus muscle anchors itself, while the posterior surface is a common place for many muscle attachments. The medial surface, though unremarkable, completes the trio. The shaft's borders are equally important. The posterior border can be palpated along the forearm's length, and the interosseous border is where the interosseous membrane connects our two forearm bones. Lastly, we'll examine the distal end of the ulna. The distal end of the ulna, although smaller, plays a key role in forearm movement. This end of the ulna is considerably less prominent compared to the proximal end, and ends in a rounded structure known as the head of the ulna. This head is unique as it possesses a distal projection, which is referred to as the ulnar styloid process. This styloid process, while it might seem inconspicuous, is integral to the stability of the wrist joint. It serves as an anchor point for ligaments and helps keep the wrist bones in place. Now let's talk about the distal radio-ulnar joint. The head of the ulna, in conjunction with the ulnar notch of the radius, forms this joint. This articulation allows for the rotation of the forearm, aiding in actions like turning a doorknob or twisting a screwdriver. That wraps up our exploration of the ulna bone, a crucial component of our forearm's anatomy and movement.